Hi, my name is Jared Ziegenbein, and I am at the St. Francis Medical Center College of Nursing. I'm in their BSN program, which is a 2 years bachelor's program. Thank you for stopping by today to get more information about our program, and I hope we can answer all your questions. For me, I am currently in the program full-time, so that means that I am in classes, I'm in clinical, we're in the simulation lab, doing a little bit of everything. And I'm hoping to be able to take those skills and things that I've learned in the classroom as well as on the clinical floor and jump right into a full-time bedside nursing position at the medical center. That's my current goal. Through my studies, I've found that the specialty that I really am interested in is pediatrics. So I haven't really been able to narrow down quite yet what exactly I want. But I've been looking into the pediatric intensive care unit, the neonatal intensive care unit, and then also even just pediatric acute floors. I chose St. Francis Medical Center College of Nursing because I grew up in the area, and so I've always known that St. Francis has been a place of, just the highest level of care given across the board. So for me, it was almost a no-brainer applying to the program because I wanted an immersive experience that was going to teach me, everything I needed to know clinically, as well as, learning from other staff members that already work at the medical center, how to really, utilize compassion and give the greatest care to all of the people that step through our door. So for me, it was a very easy choice. The faculty and staff at the College of Nursing has been unbelievably amazing. They are, anyone from your advisors to your clinical instructors to your professors, they just care about you as a person, not just a student. You're not just a number. They're so focused on making sure that everything that you do is correct and accurate, but also to the standards that you hold yourself at. They're not worried about getting you to get an A+ or just getting a good grade. They want to make sure that you understand the material, you feel comfortable with what you're doing. They push you to challenge yourself. And I think that is so valuable and something that a lot of people should really look for in a college. What's great about having the College of Nursing and the medical center in such close proximity is that in the classroom, we are learning procedures and policies that are used at the medical center. There's no guesswork, there's no kind of having to double up on policy searches and stuff like that. It's very fluid, and I think that really helps as a nursing student because you have so much on your plate. You're always so concerned with what's next that it takes a little bit of the guesswork out of it, and I think that helps a lot, especially as a full-time nursing student in the BSN program. You're already stressed out, so it's nice to have a very easy transition from college to medical center. The length of time that the program takes, so in the BSN program, it's 2 years, which is expected of you to already have your prerequisites done. So when you come into the program, it's just 2 years of strict nursing courses before graduating with your BSN. I think that's a great time period. It's long enough to really get that immersive experience both in the classroom and on the clinical floor. But I would also say that, if the program were any shorter, I feel like I would be almost missing some experiences that I could get because there's just so many units at the medical center to get experience on, from pediatrics to gerontology to general adult floors, med surg, different things like that. So I definitely think 2 years is a great amount of time because they break up the clinical rotations that we go on as students. So it's definitely, I think, awesome to have a full 2 years of time where you are still in classes and on the clinical floor. And going along with that, the cost of the program is actually very comparable to anything I've seen before. And I think that it's very easy to get loans and scholarships, and there's tons of financial assistance offered by both the medical center and the college itself, which helps a ton, especially as, a young adult where you're kind of getting your feet out there, you're going into college and you're like, how am I supposed to pay for all this? So the medical center and the college do a great job of making sure you're covered. I think something that really stands out to me about the College of Nursing at St. Francis is that we have constantly growing groups of students and faculty. They're always changing, always updating, and I think that that really helps because the field of nursing as a whole, always changing, always growing, always advancing, and I think that as students, we can find ourselves get stagnant because once we learn something, we're ready to move on and put that aside into, a bank for later. But with nursing, you can't really do that because it's so dynamic. Things are always changing. And I think that the College of Nursing does a great job of staying on top of those things. We read research studies, we read different policies and things as soon as they come out just so that we stay on top of it. And I think that that really kind of puts us at a bar above just because we're always staying on top of what's next. Thanks again for stopping by to learn a little bit more about our program and the College of Nursing as a whole. I hope we were able to answer all of your questions, and I wish you the best of luck on your journey in nursing.